So yeah, welcome everyone to this webinar on findings from our Health Systems Response Monitor, which is, as Kathy mentioned, a tool which is designed to keep track of what countries are doing to respond to the COVID-19 pandemic within their health systems. This is a tool that we designed in the European Observatory with support from the WHO European Regional Office, as well as the European Commission. Now, for those of you who may be a bit unfamiliar with the observatory, we are a partnership that's hosted by WHO, but we also include within our partnership is our other international organizations, including the European Commission and the World Bank, a number of national and regional governments within Europe, healthcare organizations, and academia. And the majority of our staff are actually, myself included, are embedded in universities across Europe, mostly in London and in Berlin. And so it's this link with academia that really is our mandate. It's our main objective in the observatory. We work to support evidence-based policymaking in Europe by bringing academic evidence, by bringing research to policymakers, and to try and help them with their decision making, so that they're using the impartial and the most rigorous evidence available. And it's this mandate to support policymaking, which is what drove us to create the Health Systems Response Monitor back in March, when the pandemic was still really kicking off in Europe. We had noticed that, well, there was a lot of work looking at what countries were doing in terms of travel restrictions, or in terms of school closings or business closures, and a lot of work to understand, you know, who was preventing whom from entering their countries. There was not much work really collecting information on what health systems were doing. And this is incredibly important, because the extent to which a country is able to weather the COVID-19 pandemic is going to largely depend on their health system response, on whether they have the right enough health worker capacity, whether they have enough PPE. And we felt like this was a great opportunity for us, since we are already working closely with governments to knowledge broker, to bring this sort of evidence on a regular basis. This was a great opportunity that we felt that we needed to keep track of what countries were doing, so that countries could get innovative ideas during this rapidly changing situation, that they could sort of see what other countries were doing and identify gaps in their own responses. And just to document, because there's no way to learn lessons going forward if we don't have an idea of what countries are doing. Now, our approach has evolved over time as the pandemic has evolved. So initially, as I was saying, you know, we focused a lot on the things like, how do you get enough ventilators? How do you deal with influx of patients when you are already at full capacity? And this is when we were collecting this sort of information and really trying to synthesize, well, what are the messages for countries? What can they be doing? But as this has evolved, you know, we've changed our own focus, and that's the reason we thought we'd have this webinar today, was to make you aware of of this work that we're doing, but also sort of give you a sort of a sneak preview of where we think things are headed, and where in the future, hopefully, that you would turn to the HSRM tool as a sort of way of seeing where the pandemic is going, and where you might look for best practices. And so the hook for the session today is really looking at how are countries getting back to normal. And of course, you know, no country is fully getting back to normal, but there are clear examples of successes or preconditions that countries seem to be putting in place that seem to at least be working, or at least seem to be having some sort of impact. And so that's sort of the hook for today of understanding, well, what are we learning from countries in terms of how they're making it so that they can get to some degree of normal. So before we start getting into the research itself and these comparisons across countries, we want to give you a more intimate look at the tool, so that hopefully you are able to use it in the future. It's something that we constantly are updating. And so my colleague, Susie Lessoff, who is the Director of Management in the Observatory, she will walk you through the tool itself. Over to you, Susie.
Thanks, John. Maybe if you could put up the slides, that would be great. Basically, as John is saying, we really think that this tool can be very useful for you as a way of seeing what it's the evidence that's on what's happening and what policy choices there are, but also where the pandemic is headed. Maeve, I can't see it as full screen, but if you could perhaps go to the next slide and try and make it full screen, that would be great. The platform fundamentally does 4 things, and this is the first one. It collects and checks and organizes all this country information so that you can actually capture what the health systems are doing. So if you want to use that facility, what you do is you go to the front page, which is here, and to this box on countries, and there's a drop-down menu with all of those. If you go to the next slide, Maeve, you'll see this is what you get to if you, for example, pick France. It's a way of us organizing the information so that you can navigate through it and find what you want. It's slightly health systems oriented because that's where we're coming from. But basically you can see, we talk about preventing transmission or about workforce or about delivery. So that would be 2-track services, what we do as we go back to normal with a follow-up for cancer patients, that kind of thing, paying for care and governance issues. So all of those are organized in the column that's on the left-hand side. And we're updating, as John said, all the time. And the way we highlight that is both by putting the newest stories in that very central panel with a red heading and talking about those, but also you can see underneath each of the left-hand categories that there is a little marker which tells you the latest update. And again, there's links at the bottom. So when you come into the France page, you can see these are the top 4 stories, and that's perfect. That was a perfect change. Back to the German page, Maeve, that's perfect. That's what you get if you want to see the detail, is you click on the story that is most of interest to you. This one, because it ties in with what we're going to talk about later, is on long-term care facilities. So you get a rather dry but very, I think, useful batch of information. You know it's right. At the bottom are lots of sources, which I think for journalism is very useful. At the top, what you'll see is a couple of names. Those are the experts who've done the post, and they could be useful sources for you later. So in terms of what's happening country by country, you have it all there. And if you wanted to go from Germany back to France, on the top at the second tab along is a countries. Again, you get another drop-down menu. You can go anywhere else. If you go to the next slide, Maeve, you can see what happens if you actually explicitly want to compare. So we know that people are interested in what's happening in batches of countries where they feel there's an affinity. So the Germany and Austria thing, or a country like Slovenia that tends to see itself either with former Yugoslav countries or with a batch of EU member states. UK might want to look at, Belgium, Andorra, whatever at the moment. So here you go to the cross-country feature, the second window, and that will take you to the next slide, which is basically a page that offers you a chance to choose the countries that are particularly interesting to you. So you just highlight the ones you want, and then you have in the second half of the screen a chance to pick the topics. And that the final click, if you like, is you generate a PDF, which is in the next slide. And it just shows you that what it's actually done. Maybe the next slide. Could you? Thanks, that's lovely. Gives you a sense of all those 3 countries. So what Maeve's picked on here is Austria, Italy, the UK, and governance issues. And that she's pulled those together into a single report, which we hope will help you, not just to make comparisons, but to set what you're finding out in context and put your stories into a more European setting. The next feature of the platform is the next slide, Maeve. This sense that it guides you to other places. We don't claim to be the most up-to-date source of the numbers because many international organizations are working on that, and there's always a risk of duplication and conflicting numbers. So we're using other people's stuff. So if you click on this and we go to the next slide, Maeve, it will take you to all sorts of websites with very, very up-to-date data, but it will also take you to analysis, which is best practices, interesting articles. So again, we're trying to channel you, be a mini portal which helps you find good stuff for your work. There is just on the right here, slightly randomly, a little note, we have a subscribe to weekly alerts one, and there again, you just pick the countries that you want to hear about. If we go to the next slide, and I'm going to ask my colleague Sherry to help participate in this bit. Basically, we're aware that that's a lot of data, it's quite clunky. We're trying to pull out what are the real stories for you. So we have this feature called cross-country analysis, where there are snapshots of different responses. And if you go to the next slide again, Maeve, that is talking about what is interesting, what is topical, what is important. And for us, the reason we feel that we're pulling out those stories right is that we're getting questions from countries, we're getting questions from WHO and the EC. We've also got some remarkable experts involved in our work, including Martin, who is on the call, and they're spotting the emerging issues, and all of our staff who are looking and collecting and collating the evidence are picking up on patterns and trends. So we think we're able to surface these examples of good practices, these challenges, and again, you know, there's always links to key documents. So the important thing, I think, is we're picking the right issues, but also we're constantly updating as policy and practice evolves. So Sherry, perhaps you could just explain, unpack a tiny bit, some of those updated stories on the right.
Thanks, Susie. I'll pick up on the first two stories at the top of the country analysis page. The most recent policy snapshot, which went up on Wednesday, looks at the regulatory obligations regarding personal protective equipment for health providers. So it provides some insight into how this works in practice in different countries. We use the platform and we observe that the design of these measures not only influences equity, but also the opportunities for centralized procurement and benefits from economies of scale. Another post, the next one down, looks through the lens of governance and it focuses on federal countries. So here we review the platform to understand the distinctive coordination challenges and responses that federal countries have taken. Thanks, Susie.
Great, Maeve. If we have the next slide, it's just, again, that sense to give you a feel. There are a range of these stories covered, and you can see that sometimes these are ones that Natasha and Marina will talk about later, long-term care, issues about tracing. There's evidence, but there's also angles like the kind of issue of equity or the conflicts that come up that Sherry flagged, which aren't necessarily immediately obvious. And the next slide, we know that all those stories will often have connections. So if you're talking about whether you're a centralized or a decentralized country and you're talking about procurement, these things obviously interconnect enormously and quite important. So at the bottom of that country page, anytime you pick a story, you can see the related articles. If you just go to the next slide now for a second, Maeve, thanks. Basically, we anticipated a number of frequently asked questions. So the next couple of slides I won't talk to, but if you do want after this finishes to go back and check things, they're in there. And now, John, I hand back to you. Over.
So that was really useful to understand how the tool works. But now we're going to get into some of these more deep dives into particular questions that understand what countries are doing to try and get back to normal. And one of the areas where countries are trying to get back to normal is, of course, thinking about care homes. Since this is somewhere where there have been, by some estimates, around 50%, around half of deaths have occurred in care homes. So there's a lot of interest in figuring out what countries are doing to make care homes back to a more normal existence. And so we have Natasha Curry, who's the Deputy Director of Policy at Nuffield Trust, who's been working closely with us as well as with WHO on these issues. So I'm going to hand it over to Natasha for some interesting findings about what countries are doing in care homes to make them safe and try and reduce transmission. Over to you, Natasha.
Thanks very much. Maeve, do you mind putting it on full screen? That's it. Thank you very much. So yeah, as John said, I've been using the monitor to look at what countries have been doing to protect care homes, because we all know that the care sector has been hit quite badly by COVID, with nearly 50% of all COVID-related deaths taking place in care homes. But what we also know is that those care home deaths have not been uniformly distributed across or between countries. So the question I've been looking into is, well, what have countries been doing to protect their care homes? Can we learn anything from that? Can you go to the next slide, please? So what we found in our analysis is that countries have used a common set of measures to protect care homes, and that stretches from an increased oversight of the care sector with the issuing of national guidance and a tightening up of the kind of regulation and oversight and monitoring at a national level. We've also seen an injection of extra funding into the systems in most countries we looked at, and attempts to boost staffing numbers and the way that staff work across the sector. So the profile of work in the sector means that many staff work across multiple care homes often. So some countries have taken measures to stop that happening, to try and control the spread of outbreaks. We've also seen a package of measures taken to prevent and manage outbreaks within homes when they happen. So the key measure taken by most countries has been a restriction on visits, and that's visits from family, as well as healthcare professionals and other professionals who might have regularly come into homes to provide services. We've also seen the isolation of symptomatic residents routinely, and we've seen an increased rolling out of testing to residents and staff. And that started in a quite limited way, but what we've seen over the last few months is that expanding to now include regular testing of asymptomatic and non-symptomatic staff and residents. Can you have the next slide, please? So given that we know that countries have generally taken a similar package of measures, what might explain how the different impact in terms of death rate? Well, it's very difficult to unpick that with the data we've got, but we have made some observations about differences between countries. So one of the key differences is how quickly countries reacted. So we have, for example, the Czech Republic restricted visits to care homes the day after its first infection in the country, and that was early March, whereas in countries like England, Hungary and Greece, that didn't happen until early April, although we do know that care homes themselves were taking measures individually before that government guidance was changed. We've also seen a bit of a difference in the kind of visibility and that clarity of accountability at a national level of the care system. So there has been quite a bit of criticism in England that the care system was a bit forgotten. So there was a big focus on the health response, but the care system was not really considered in all of that. And it's not really clear who's leading the care response in the English context. Other countries have sought to really strengthen the clarity of accountability. Ireland and Hungary are two examples that appointed COVID leads in each long-term care facility to provide that clarity. Now on PPE, every single country we looked at has struggled with its supply of PPE. It's a common problem, but the response has been quite different. So we've seen on the one hand, places like Estonia and Denmark taking a very centralised approach and setting up a central supply chain, and Estonia and Italy combining health and care supply to streamline it. Whereas in England, we've seen care providers left largely to source their own PPE supply. So it's a bit of a difference there. Funding similarly has taken different routes to allocation. So we've seen in the Irish context, care homes receiving direct payments to take account of excess expenditure. The Netherlands and Germany similarly see providers being reimbursed for extra expenditure through the insurance system. Whereas in England and Sweden, where the care systems are managed at a local authority level, the money has been given to the local authorities and they have had the autonomy to allocate that. And the implementation and monitoring of guidance has taken different forms in different countries. For example, Germany has given quite a lot of autonomy to its state, so we've seen a different response across Germany, whereas countries like Hungary, Greece and Iceland have taken a much more centralised directive approach. Have the next slide, please. So the question is, well, what works? What can we learn from this? And I think it's really difficult at this stage with the data we have to say this measure works here. And I think what we need to understand is that the context really matters here. So the pre-existing structures are really important. For example, some countries where the health and care systems work very closely together and are quite seamless, we've seen them being able to bolster the healthcare and medical care that they've been able to put into care homes. Whereas in other countries, perhaps in England, and as an example, where the systems are quite separate, we've seen a lack of joining up of policy and response. We also need to remember that the care sector is quite fragile in a lot of countries with historic underfunding. We have a chronic shortage of workforce across the region, which has put staff under great pressure and put providers under pressure and made it very difficult to enforce things like self-isolation if people become symptomatic. So there are some really key questions I think that we need to address now. What can we learn from this wave? How can we understand what's been effective and why? But also we need to think about balancing the measures that we've used to control infection with the well-being of residents. So there's some evidence that suggests, banning or restricting visits to care home residents actually had quite detrimental effect on their well-being. So how do we get that balance right as we go forward? And then in the longer term, the big question is how do we put the care sector on a more secure footing to better weather this storm as we go forward? Thank you.
Thanks, Natasha.
Hi.
Really good insights.
Hi, I can turn on my video now.
Yes, yeah. Marina. Yeah, no, perfect. Marina is going to go next. So just to quickly introduce Marina. So Marina is a research fellow in the observatory based at the School of Hygiene, and she's going to talk about the issue of how do we, of course, we know that no country is going to get by without having additional cases. And the part of getting back to normal is going to be about how do you find those cases? How do you isolate them? How do you then find all their contacts and make sure that these little flare-ups don't become a major outbreaks. And that's sort of a really crucial element to being able to maintain some degree of normality. So, so Marina's going to tell us about what we've learned from European countries in trying to do this most effectively. So thank you, Marina, please go ahead.
Thank you, John. And next slide, please. So what we know at the moment is a lot of countries are trying to keep their numbers low to avoid a resurgence of cases or to avoid second wave. And these strategies mainly revolve around test, trace, and isolate strategies. And for example, these are two examples from the UK, from the independent SAGE that is focused on find, test, trace, isolate, support, or example from New York that, that suggested how to do the effective contact tracing. And next slide, please. So what do we have in HSRM on this? And one of the posts that were done by the colleagues John Silas and Selina Rajan and Martin McGee is what countries need to do to implement effective find, test, trace, isolate, and support strategies. And as you can see, this post has a very helpful graphic about the issues that boost these strategies or create additional setbacks on the contrary. So, and these are the issues that we learned from the countries. So for example, if the lab is collocated with the testing facility, the samples will get there faster, and or if, for example, the tracing team is very strong, this can serve as a boost to all these strategies and helps to keep the numbers low. But what's actually in the HSRM on specific countries? Next slide, please. We can see examples here. So what countries actually do to effectively test or to trace or to isolate. And it's not just examples of countries, but also we can see what are the common challenges and issues. So for example, we know that all countries at some point had less capacity than there was a need for it and how they dealt with it. So for example, some countries started manufacturing their own tests or started relaxing their regulation, and what strategies they use to report the tests more quickly back to the authorities or back to people so they can isolate sooner, and what countries do to trace more effectively. And we found that mostly countries are reliant on the very strong local public health infrastructure, or if they don't have it, how they boost their tracing teams with additional workforce from different areas. But then the key would be to have a very well trained workforce, how they are relying on various digital technology, or are they doing manual tracing, for example, like in Belgium and France. And finally, for isolation, what's important is also to have the support for people who can isolate, and some countries provide additional accommodation for them if they cannot isolate on their own effectively, or they compensate for loss of income. But it's also important to be able to enforce the isolation so that people who need to isolate actually stay isolated. So this is just an example of one of the posts, but there are more on this topic there, for example, specifically on contact tracing or on use of digital technology. Thank you.
Thank you, Marina. Where did you go? We've worked, so that was really useful, Marina. So as I mentioned early on in the introduction, the role of the observatory is really to serve as this bridge between academia and policy. And so we work very closely with people in both. And so one of those people we work extremely closely with is Professor Martin McGee, who is a professor of European Public Health at the London School of Hygiene and Tropical Medicine, among many other titles. And so we wanted to ask Martin to come on and talk a bit about the types of lessons that he sees coming out, the international lessons that he sees coming out of types of material that's included in the HSRM, and sort of where he sees have been really the successes and the failures, and where there might be sort of particular countries or examples or topics that he thinks are really the ones that we should be digging into and that are the most newsworthy. Martin, please go ahead.
Okay, thanks very much. So I'd like to first of all congratulate the team for all the work that they have done. And of course, we do have quite a lot of information on COVID internationally. We've got the basic numbers. We can go to the Johns Hopkins site. The Financial Times has really been doing a huge amount of very valuable work. And we can look at what countries are doing in terms of the number of cases, the transmission of infection, the deaths. But the question is why? Why have some done better than others? And we really need to know this because none of us have been perfect. Well, maybe New Zealand, which stands out as having done exceptionally well, but essentially all of us have challenges. And even those countries that were doing very well at the beginning, like Germany, for example, are now seeing cases creep up again. So we desperately need to learn lessons from who did well and who did badly. If you're doing policy, you have a challenge because there is a vast amount of information overload at the minute. One estimate in a journal I read recently suggested that there were about 4,000 papers on COVID being published every week in peer-reviewed journals and in preprints. And we're drowning in all of this information. So there's a huge scientific task in trying to synthesize all of this, but there's also a challenge in trying to synthesize the policy lessons as well. The difficulty we have there is that what tends to be reported is from a limited number of countries, and it tends to be from the big countries. So if we watch the media in many countries, we'll see a journalist, a TV report will come from Spain, or at the beginning from Lombardy in Italy, from France perhaps, from different parts of the United Kingdom. But what's happening in the Czech Republic or Slovakia or Finland or Norway? Sweden, admittedly, we do get a bit about because of its particular policies. But the challenge is that there are lots of ideas that are coming out from these countries that we can really learn from. And unless we have some mechanism to bring it together, we're not able to do that. And that's what the Observatory's COVID Response Monitor does. Of course, it covers the large countries, but it covers the small countries too. So what have we learned? Well, of course, there are lots of things on individual interventions. When it came to face coverings, we learned a lot from the natural experiment that was done in Germany, where different cities were imposing them at different times. It was a very important natural experiment, and that added to our knowledge. And we could take examples like that. We could take examples of problems with, for example, sending people out of hospital into care homes, which created difficulties in England and in Hungary, for example. But we don't have time to go into all of that. So what I want to do is to pick out the three big areas that we've really been prompted to think about. Why have some countries done well, and why have some countries done poorly? And we can think of these three broad categories as being the political, the scientific, and the organizational capacity. And there is absolutely no doubt that political leadership, governance structures have played a role in terms of the willingness or the ability to act quickly, for example, and fundamentally the trust in politicians. And I won't go into the individuals concerned, but I think it's already very clear that there are some heads of government who are highly trusted and some who unfortunately are not trusted. And when the lack of trust, when politicians who are not trusted give out mixed messaging, or whenever there is seen to be one rule for them and another rule for others, then we have a problem. There are issues also around political structures about centralized and decentralized countries. Where is the power? Do the people who have the information have the ability to make and implement the decisions? And then we have the scientific advice, and that's really been quite complicated, because you might think that it would be great to have really first-class scientific advice. And some countries, because the larger countries with large, well-developed academic communities have been able to do that. But there's also been a criticism of that, because sometimes that quest to have perfect evidence from multiple randomized controlled trials and meta-analyses has actually held back the decision-making. And in England, for example, a parliamentary committee has said, well, maybe we didn't adopt the precautionary principle when we might have, and we were waiting for too much information, waiting for having the perfect information. But of course, on the other hand, you need some evidence. So getting that balance right is really important. And then finally, the organizational capacity. If you are a country that went into the crisis with very limited hospital facilities, intensive care capacity, and so on, your focus was inevitably on protecting that. Whereas if you went into it, as Germany did, with a lot of capacity, and some German colleagues would say perhaps too much capacity, then that becomes less of a worry. So I've just concentrated on the big picture issues, but underlying that, there is a wealth of material on individual interventions, individual policies, and we in the academic community have found the response monitor to be an absolutely invaluable resource. Back to you, John.
Thank you, Martin. That was very good. So I'm going to bring everyone, all the panelists up now. We've been receiving some questions throughout, some of which have been on the presentations themselves, and others have been on other topics which are in the HSRM, which is really nice to see. So I'm going to just pick a few of these questions. I'm going to go, the first one, I'm going to pose to my colleague, Ewout van Rinniken, who is the coordinator of the Berlin hub of the European Observatory. Let's see where it went. So Ewout, so to paraphrase this question, so one of the big issues, which Martin touched on a bit, is communication and how government is communicating information to the public, because obviously this is going to determine the extent to which people actually comply with rules, with social distancing rules, with mask wearing rules. Is there anything interesting in particular that you're finding that countries are doing to get their message across, to communicate, so that they seem to be having more success in getting people to comply with their instructions?
Sure, thanks, John. So we have a full contribution snapshot, as we call them, on the website on the communication channels that have been used in the crisis. And what we see is that there is a trend more and more also to use, apart from big media events with leaders, also to use social media. So you have to think of Twitter, Facebook, Instagram to get out the message. But some countries also are moving much more to direct messaging. So where they try to reach persons, especially young people, directly. So you can think of WhatsApp or simply an SMS, but also Viber and Telegram, which are some of the services used in certain countries. I think that what it's I think teaching us is that now that we are entering a phase that we see more transmissions among young people, that communicating and reaching out to young people becomes important. These are some of the mechanisms that can be used. Another, I think, thing we see here is that with more local outbreaks to be expected in this transition phase, or perhaps sometimes even a second wave, we need to have also targeted local communication in place, and that's difficult to do the traditional larger channels, with a leader talking on TV. So also here, I think that social media and especially direct messaging can play a role also to in these local outbreaks. Of course, what remains important and is really coming to the fore in our contribution on the website is that leadership is incredibly important, and Martin was talking about that already, that there needs to be one coherent, transparent strategy that people can understand, and that also these sub-strategies, even on a local level, are in line with a larger strategy that is planned from the central level or a regional level, depending on the country. Thanks.
Thanks, Ewout. So looking at the questions, I have another question, which is on a totally different note. It's much more of a data question, I think. So I'm going to turn this question over to Marina. So the question is really about testing. So there's okay, everybody, welcome everyone. It's about testing. So it's been in the news a lot about countries that claim to have the best testing, the most testing. And of course, we know that there's lots of issues with comparability of the data, of mortality data and of case data due to testing, because different countries have different criteria. If you tell us a little bit about how comparable this data is, how are journalists using this data appropriately? What can they, and journalists and researchers, to be fair, how should we go about understanding these data given the issues with testing? Over.
Thank you, John, and thank you for the question. Well, I think the main issue with the testing data is being mindful about what actually it means in the context of specific country, because what we found is that different countries had completely different testing policies. So for example, while almost all countries in the region were testing people who were in the hospital with suspected COVID, very few countries actually at the beginning started testing people with milder symptoms or started testing essential workers that were out there facing the public. And so it's on the spectrum, depending on the testing capacity of the country, on the policies of the country. And this also has been changing in time. Therefore, the testing numbers are not consistent even within one country, especially in the course of the first 2 months, probably around March and April, by the time that countries managed to boost their capacity. And also we need to be mindful of how testing works, because not all the tests vary, the quality of tests can vary, and it depends on the timing of taking the test, and also tests need to get back to the laboratory quite quickly, and it doesn't happen in all countries. So many tests are either not getting back, still are reported as people being tested, or they even just may never get back if they're reliant on couriers and postal services. And of course, that affects how mortality for COVID is recorded. If people were not tested for COVID, they will not be recorded as those who died from COVID, especially in those countries that rely on the tests for diagnosing the COVID death. Thank you.
Thanks, Marina. We have a question looking, I think I'm gonna give this question, if it's okay, to Sherry. So this question is about, it's in the context of reports of declines in services for cancer screening and other sorts of more routine service delivery types of things, and whether there's important lessons from countries about how they're getting back to routine, normal service delivery. So not necessarily, it doesn't necessarily have to be in the context of cancer, but that sort of seems to be where the question's originating. So what are countries really doing to deal with these backlogs, and how have they been getting back to normal in healthcare delivery?
All right, thanks, John. Well, if you don't mind, I'd like to speak about the expected changes that hospitals are making to try to get back to providing routine services. We're looking at that using the information in the platform, and we've come across several things across the countries that is a trend that they tend to all be doing, or many of them tend to be doing. So many of the countries that we've surveyed are allowing for patients to be physically separated. And the way they can do that is by repurposing clinical spaces. So taking the spaces they have, but using them differently. Some countries have introduced COVID-free wards or even COVID-free hospitals, but other countries are being very mindful of having spaces available for patients as they arrive that need to undergo COVID tests because they're presenting with the symptoms. Another thing hospitals are doing is testing their personnel. So implementing testing on a widespread level across the health workforce. And we've seen this in France, where following the first wave, they've tested all the hospital health workers. Another one is prioritizing or rationing treatments. So in the case of the Netherlands, the medical community stood up and said, these are the priority treatments, not emergency treatments, but the urgent care treatments that needed to be prioritized. So you mentioned cancer, but there are other important disease areas that have been waiting for services, and now they're reopening. Another one is about triage. So how triage is being undertaken when someone presents at a hospital as an emergency case, having a separate almost patient pathway for those patients presenting symptoms and those who aren't, and making sure those aren't being crossed over. One that covers both hospital and out of hospital care is this idea of moving towards an increase in teleconsultations. So volume of seeing patients outside the hospital. And in England, digital consultations have increased, and that's planned to be continued, such that there are care models like virtual wards. So COVID patients are being discharged into a virtual ward outside the hospital. And just one more thing I'd like to say is about the need for continued investment. So in facilities, in PPE, and in staff. So particularly in staff, seeing the staff that have come back to the health service during the COVID crisis, and really holding on and maintaining the staff that are still needed to provide health services in and outside hospitals. Thanks, John.
Thanks, Sherry. So we have time probably for just one more question. I'm going to send this question to Natasha. So Natasha, of course, thank you very much for talking earlier about what's been going on in care homes. So this question is, I think, related. It's trying to extrapolate maybe from the lessons in care homes, but also looking beyond care homes, looking at home care and issues facing vulnerable people in particularly living in multi-generational households. Is there anything interesting countries are doing to try and support these people or try and support home care, make it safer, make it still accessible, that you think are particularly interesting?
Yeah, I mean, as you point out, care homes are a tiny proportion of the care sector, and a lot of care is delivered in people's homes and in the community. And I think the main observation is that home care has been largely invisible during the pandemic. The debate about it has been largely absent in a lot of countries. Countries belatedly recognise importance of care homes, but I haven't seen much evidence of that now translating into measures around home care. And it's a particularly complex area because a lot of home care is delivered by unpaid carers. And there's been, in most countries, what we've seen during the pandemic is the shutting down of the community-based services that they normally rely on, respite and day centres, etc. And so I don't think we have a very good understanding of what the real impact has been yet on the home care sector. We know a little bit about domiciliary care, so the complexities of making sure that home care workers are equipped with the right PPE and trained to use it has been a real challenge in a lot of countries. But I think at the moment, I think we need a much bigger focus on home care and understanding what the impact has been on service users and their carers.
Thanks, Natasha. And actually, this is a perfect way to end the session. We are just exactly on time. I want to thank the panelists for all of their contributions and the attendees for the very good questions. We hope, this is meant to be really a taster of the types of information that we have on the platform. Obviously, in 45 minutes, we can't go through specific interesting things or topics that are specific to particular countries. But hopefully this gives a sense of sort of what's available, what's out there, what we've been collecting, and that you will feel free to get in touch with us directly and continue to hopefully use the platform to come up with ideas for stories and sort of be one step ahead of the curve following what's going on with the pandemic. So with that, thank you very much. And the webinar comes to a close.